Hi, everyone. Yeah, you're more than welcome. It's certainly an area that's quite complex, and I think a lot of people are feeling really uncertain about it, and that's totally normal. There's some good information out there, and then there's also a lot that's, it's just kind of unclear who this applies to. So hopefully this will clear up some of that and, reduce some of that ambiguity. So just a bit of housekeeping to start off. Just want to recap. The webinar today is on the COVID-19 protection framework, commonly called the traffic light system. So if you think I'm going to be talking about something completely different, you might be in the wrong space. But if that's what you're here to listen to, then you are in the right place. So this meeting will be recorded. So if you get, urgent phone call or something come through and you have to leave, or, tech issues, you will be able to access the recording post this. That also does mean, though, that anything that is asked as a question in the chat is public. So when we get to kind of the question bits at the end, if you have something that's quite a specific situation to you, just kind of keep any kind of key personal details out of it. You can also use the Q&A function to ask me a question, and you can do that anonymously. But otherwise, if you don't want me to read your name out, or you've got kind of sensitive information in your chat, just mention that it's anonymous, and I will make sure that that gets honoured. Perfect. So before we jump in, I just kind of wanted to do hey, this is tough. And we're in, day 364, it feels like, of lockdown in Auckland, and we're all a bit over it. And there's a lot of information out there. There's a lot of misinformation out there. So I just kind of wanted to give everyone a time and space to take a deep breath. You're not alone. We're all in this together. And hopefully today you're going to get some clarity on some of the new things coming in. So what are we going to talk about today? We're going to talk about what the framework actually is and some tips on how you run your business under each light. So the red, orange, yellow, red, orange, green. What can you do to prepare now? So this framework isn't in place yet. So what can you actually do now in preparation for it? Some common pitfalls that we've seen or kind of think might come into play when this is all live. And then, of course, some questions. So I'm going to save the majority of the time today for questions. So, I know it's such a complex issue that's probably what most people are really excited to get from today. So high-level overview of the traffic light system. And one thing I want to say is the COVID-19 website does have a PDF that has a really simple, easy to kind of understand outline of what you as a business can and can't do under those levels. What's important to understand is that there's some kind of overarching principles here. So public health measures are always in place. So the social distancing, masks, hygiene, contact tracing, all of that stuff is still in place, and the framework will support that has to happen and continues happening. You can choose whether or not you want to require vaccine certificates as a means of entry. Now, currently, that is limited to hospitality, events, gyms, tertiary providers, and close contact businesses. We'll come on to what a close contact business is in a minute as well. So if you do choose to opt into using these vaccine certificates, then you can mandate vaccinations for customers and staff. So for customers, you can mandate that people entering your premises have to be double vaxxed and have to display a vaccine certificate. And for people who you employ, so your team, you can mandate that they have to be fully vaccinated. The important thing with this, the second point when it comes to employees, and we'll talk about this with the common pitfalls, is that you're going through a proper process and you're engaging in good faith. So people need an opportunity to come back to you with feedback, and you need to consider alternatives. So is there another part of the business that they could be employed, they could do work in? I see someone's asked a question about vaccine passes. So the information we have from the government is that this is the actual vaccine certificates are coming, but currently what you can ask for a proof of vaccination is a letter from your GP. You can apply directly to the Ministry of Health, and if you have your NHI number, I believe that will get sent to you within 2 to 3 days. If you don't have your NHI number, it's longer. And then you can also use the MyCovid website to log in and get your vaccine cert there. So what are the different lights? So you've got the red light, which is obviously the highest level. And this is kind of similar to what we've been used to under level 4. The difference is that there's a lot more that's open. So if you choose to use vaccine certificates, you can open, but there are restrictions. So there's a restriction on number of people. For hospitality, people need to be seated and separated. For tertiary providers, the option is still, or the preference is still to provide that remotely, but you can have people on campus with the vaccine certificates. If you do not opt into the vaccine certificate, you are closed. So if you're a hospitality business, you cannot operate under alert or under light red, whatever they're going to call it. Keep wanting to call it alert levels, so we'll try to stick away from that. Under orange, you've got with vaccine certificates, you can be open and there's no restrictions. So you can have more people, gatherings and places of worship can open. Again, you're using vaccine certificates. If you are not using vaccine certificates, then you can be open, but with restrictions. So there again is those social distancing, seated and separated, those kind of things. And then under green with vaccine certificates, you can be open with no restrictions. So it's really, really broad. And then without the vaccine certificates, you can be open, but there are still restrictions. They are less so than orange, but they are still there. So that's a kind of key overview of the different areas. Okay, I've got a couple questions. I'm going to come back to those because one's quite specific, and the close contact question I will answer in our next slide. So what can you do now? What can you actually practically as a business owner do right now in your business? So you can establish whether or not you're a close contact business, and this is one of the questions that's come through is there a legal definition of what a close contact business is? Is there a legal government approved, this is how we're defining close contact businesses? No. From what we understand and from what we have researched in terms of what the intent of the framework is, we are recommending that people ask themselves a couple of key questions. So can you deliver your services remotely? So if you're a hairdresser, you cannot cut hair remotely, right? It's not possible. If it is, I want in on your technology because that sounds awesome. Can you reasonably operate with other control measures? So can you run your business with everyone wearing masks, everyone being socially distanced? And then finally, your interaction with the public, is it very close? Like, are you, to deliver your services, do you have to be within 1 meter of the public? And is that for an extended period of time? So if we look at retail, which is not covered by this framework in terms of being able to use vaccine certificates, you can reasonably operate remotely, you can reasonably use other control measures, and while you are in direct contact with the public, there is a wider element of space, and it's usually shorter periods of time. Whereas if you're a hairdresser or a barber, you cannot reasonably deliver your services remotely. You can't really use any of the control measures. You can't really cut someone's hair from 2 meters away. And you can't really use masks either because, if you're needing to get up in the hair, the mask's not going to hold on. And of course, you are really close to the member of the public and for an extended period of time. So that's what we would define as a close contact business. So if you're unsure, if you're kind of on the borderline of those things, you're not, you're kind of like, I kind of fit this, but not really. You can, of course, seek advice. If you're a MyHR client, let us know, give us a call, send us an email. We can help you kind of determine this and talk through a couple scenarios with you. The other option is that you work under the assumption that you are and just communicate that clearly to your team and your customers. This is, we believe we are a close contact business because of these reasons, and therefore we are operating under the assumption we will be covered, and this is what that means for you. So that leads into the next step, which is decide whether or not you're going to be opting into vaccine certificates. And this is the core kind of part of the framework, right? So do you want to use them, yes or no? We can't answer that question for you. This really comes down to your personal standpoint, and whether or not you're comfortable with restrictions on your business and ability to trade under the different light levels. And then what you can do from here as well is start planning. So one thing that's really important to remember is that this framework is not in place yet. And the legal framework that will sit behind this, I don't know whether that's going to be in addition to the health order or it's going to be a separate piece of legislation. That is not in place yet. So you can't mandate anything for your employees yet, but you can start planning. So you can start talking to your customers and your employees to say, we're planning to opt into the use of vaccine certificates. We believe we are a close contact business, or we're in hospitality, so we fit this criteria. And this is what it means for you. It means we are requiring you to be double vaccinated. It means we will be asking you about your vaccine status. It means we might require proof of your vaccination once this comes into play. And you want to give people an avenue to deal with questions and complaints. And this is a big one because it's the vaccine issue has become quite heightened from an emotional point of view. So you want to give people an avenue to come back to you with, hey, I don't actually think you do fit the definition of a close contact business for these reasons, or oh, well, actually, yeah, I agree that my role now needs to be double vaccinated, but you've got this role open that I don't think needs to. Can I express my interest for that role? So those are the kind of things that you can start having those conversations now in preparation for it. It's really, really important to not start any kind of termination or consultation process at this stage unless you have another legal avenue for mandating vaccines. So you've done a risk assessment, or you're covered by a health order. So I'm going to look at a couple of questions to see what we can answer now. So we've got the legal definition of close contact business, which I've answered. And then we've got, what level will Auckland move into initially? Red. Yes, that is the information we've gotten so far from the government. So as soon as Auckland DHBs hit 90%, I checked our stats just before this, and we're at 89% for first dose and 78% for second dose. So as soon as the second dose is, I believe it's the second dose is 90%, then we will move into red. So you can start prepping now, because the assumption is that when we will move quickly. But even still, you'll get at least a couple days lead in to move into this new framework. Okay. We're lucky enough that all our current staff are vaccinated, but we want to mandate any new staff be vaccinated. Can we just make a policy without any sort of consultation process? Yes and no. So with new staff, the risk here is if you need a reason as to why that role has to be done by a vaccinated person. So if that if that is supported with a health order or a risk assessment, or under this new framework, you are planning to opt into certificates and you fit one of the criteria, then yes, you can say that that role is required to be vaccinated, and you can make that clear during the recruitment process. The risk, if you don't have any of those things covered, is that it's discrimination based on health status. So that's a human rights thing, which has pretty significant penalties in the past. So that's kind of your biggest area to watch out for. So what we would recommend is, if you don't have a legal basis for making that role if you don't have a legal basis for that role to be vaccinated, then get in touch with us to see if you can run a risk assessment or something else to kind of support that. Right. I'm going to move on to the next slide and then I'll come back to these questions. So some common pitfalls, and I've kind of touched on this already. We've got a bunch of legislation to navigate here, and it's complex. So we've got the Human Rights Act / the Bill of Rights, which protects, enshrines in law the ability or the protection to discriminate based on health status, and the protection to discriminate based on religious or cultural beliefs. Now, that second one, it's untested, but from what we've seen in the legal space, it's unlikely that a belief, a anti-vax belief would stand up to that. If there is a cultural or religious reason, that's yet to be yet to be seen. With the health status one, the government announced yesterday their estimations is that there are under 100 people across New Zealand that are totally medically exempt from getting the vaccination. So what you've kind of got to watch out for there is, if that is what people are saying, you are asking for that exemption certificate, and also that you're being really clear why this is, why you are discriminating essentially, and you're doing it from a health and safety perspective. And again, that needs backing by a legal avenue, that there is no other reason you can manage this risk. The second kind of act there, that's a big one there, is the Privacy Act. So this is a key one when we're talking about vaccination status and vaccine certificates and storing those. So the kind of general principles of the Privacy Act, you need to collect the information for a specific reason. You need to tell people what that reason is, how you will be storing it, who you may be sharing it with, and how they can correct that information. And then, of course, we've got the Health and Safety at Work Act, which has your, doing what you can as a fair and reasonable employer, and doing what you can to reasonably and practically manage risks in the workplace. And that has a dual responsibility. We've seen a couple of unvaccinated people say, it's a health and safety risk for them to get vaccinated. And we've seen vaccinated people say it's a risk for them to be in the workplace with unvaccinated people. So it is a bit of a minefield. And that's where, if you get those kind of responses, definitely seek some advice in terms of how to navigate them. And then, of course, what's not listed there is your overarching Employment Relations Act. So that's the good faith, acting as a fair and reasonable employer can do. So with those, that leads into the next point, which is open communication. What you can do now is talk to your staff about what you're planning to do, what you think you will be mandating or won't be mandating, what that means for them, and seeking their feedback and giving them an avenue to give that feedback. We've seen some cool stuff that businesses have done, like provide employees time off and paid. They can be reimbursed for time to go see their GP and seek medical advice. So that's, a nice kind of value add if that's something that you want to offer. The other pitfall there is process. Process is key. So when you are at the stage where this framework is in place and you are looking at potentially terminating people because of their vaccination status, you need to go through a proper process. So notifying them what the issue is, why it's an issue, why they should know it's an issue. So, you know, we sent you this memo, this health order is in place, whatever. This is why we need you to be vaccinated. They have an opportunity to seek advice and prepare a response, and then you hear that response and consider it in good faith. So if someone comes back saying, you know, my example before, yeah, all right, I accept that role A has to be vaccinated, but you've got this role open, can I move into that? You'd need to consider that in good faith and then provide the outcome. And so the really, really key thing is not mandating vaccines unless you have a legal avenue not to, and a legal avenue to do this. And the risk of not doing that is a breach of all of those acts, maybe not the Privacy Act, but definitely Human Rights Act, Health and Safety at Work, and the Employment Relations Act, which, you know, could be some significant penalties. So hopefully that's kind of given a broad kind of overview. The questions are coming in thick and fast, so I'm going to go through now and answer those. So we've got someone who said, I run a gym and I currently decided not to operate any outdoor classes because of the difficulty of managing social distancing. However, some of my coordinators are running outdoor classes on their own and doing one-to-one sessions involving pad work. They said that the police came across in the park and said this was okay. I'm confused by what this means now for me operating classes indoor and outdoor in traffic light red. Great question. So what you'll want to be looking at is, sorry, just pulling up a different screen. What you're wanting to be looking at is under the alert level red, what does that mean for you as a business? So you're a gym, so you can opt into using the vaccine certificates. You can have up to 100 people inside your facility, and they need to be 1 meter apart. So the social distancing under the kind of traffic light system is less than it was under the alert levels. So you'll remember under the alert levels currently, the social distancing rule is 2 meters. So that's reduced. So hopefully that will ease things when we move into that, because then you can operate those classes indoor and outdoor as long as you're not exceeding 100 people and you're still keeping people 1 meter apart. During level 3, we could conduct click and collect trade and retail with no certificate mandate. Under red, it says closed, yet can click and collect activity still be conducted. Yeah, our understanding is that this traffic light system is as applicable to retail, is kind of really similar to level 3. So you can open, you have capacity limits and social distancing is in place. And if you can operate contactlessly, so like click and collect, then yes, that is the preference. We go into people's homes for work. Are we allowed to ask customers if they're vaccinated or not? It kind of depends what work you're doing. If you are covered by the framework system, so you're in hospitality, events, close contact business, so you're going into people's homes and providing like support work or like a massage, I guess, then yes, you could safely be covered by this and tell your customers that you are looking at mandating this and will be requiring vaccine certificates. If you are not, like one example we've gotten is tradies, you know, you're an electrician or a plumber going into people's homes. Currently, there's no legal framework to mandate that your customers must be vaccinated. And the risk of doing this is also discrimination based on health under the Human Rights Act. So we'd recommend not doing that. But if it is a concern that your employees have raised, then get in touch and kind of we can help you navigate that one. If you aren't a close contact contact business at all, can you still mandate vaccines for your employees? If you fit one of the other criteria, so if you are covered by the health order because you work in the prison sector, the health sector, disability sector, education, or you have done a risk assessment which shows that the work you conduct is only able to be safely done by a vaccinated person, then yes, you can mandate vaccines. If you haven't done a risk assessment or you're not covered by any of their health orders, then no, you cannot mandate vaccines. And again, the risk of doing it is that discrimination. So that's the kind of overarching big worry from a risk point of view. I'm assuming that a standard office-based business that has been able to work from home during lockdown wouldn't be deemed as a close contact business. In general, yes, that would be correct. So if you are an accountant or an HR professional and you are able to work from home, your work doesn't require you to kind of, be up in someone's face to do your work and deliver your services, then no, you probably wouldn't be a close contact business. If there is some other factor of your work that needs to kind of be done in those close quarters and can't reasonably be done any other way, you may be, but in general, if we're talking your average office-based person, no, it wouldn't be considered a close contact. As allied health presume we can deny treatment to unvaxxed as we are currently a non-essential service. Sorry, Anna, not entirely sure what you mean by that, if you're able to ask that differently. Yeah, not too sure how to answer that one, not too sure what the question is. Okay. So if we are a not close contact business, like an office, what are the rules? So currently, if when we move into this traffic light system, if you're not a close contact business or gym, hospo, etc., then there's those general settings. So the general settings are record keeping and scanning is required, so that contact tracing, face coverings are mandatory, working from home is encouraged, and then there's limits on capacity for events and stuff. That's under red. Then in orange, workplaces can open if they are like an office, but still those kind of face coverings are encouraged, are mandatory on flights, public transport, etc. And of course, contact tracing. So that gives that one. If we consider ourselves close contact and operate an open plan office, but have an employee who is out and about, not in the office very often, would we have to mandate that they cannot come into the office? Or in orange, could they come in with a mask? So yeah, if you have like a office kind of setting and you maybe have like salespeople who are leaving the office regularly to go out and be kind of in the general public, under red, if they can work from home, that would be encouraged. Under orange, you could say that as an extra measure, you would like them to wear masks when they come into the office, but otherwise you are able to open under orange. So that's kind of, a key principle of this protection framework is that 90%. So it's that kind of herd immunity. So the assumption is because the average person is vaccinated, the risk of contracting COVID-19 is considerably less. So you wouldn't necessarily have to make them wear a mask, but if that was an extra measure you wanted to put in place, you could do that. I would just recommend consulting with your employee and letting them know that's what you're planning and giving them an opportunity to feedback advice if they disagree. As an essential service, social services, would we need to all be vaccinated and write that into our employment contracts? Yes, because we won't be able to require customers to be vaccinated. So if you're a social service, like a disability support worker or, what are they called, like child youth and family worker, and are covered by the health order for health and disability services, then yes, you can mandate that all your employees are vaccinated, and yes, you can write that into your employment agreements for future employees. With that stuff, we definitely would recommend getting some advice in terms of how to write that, because there are certain kind of I guess hooks where we want to future-proof it. One of the things we talk about is being vaccinated to government standards, because if that changes in the future, if booster shots are introduced or whatever, you don't want to have to go rewrite your clauses or policies. How do you deal with an employee who's vaccinated and does not want to go into a customer's home who is not vaccinated? Can we ask the client, and can we make the employee go? Gotta love the tricky ones. So if an employee has said that they don't want to work with unvaccinated customers, you've got a few options. You could, depending on what your workforce is like and how many customers you have, and what kind of industry you're in, you could accommodate that and say that this employee will only go into customers' homes or client sites that they are vaccinated. Or it comes down to having a conversation with the employee and going, look, we don't have any clients that are, have said they're fully vaccinated. We don't have a mandate or a genuine reason to ask our customers that they are vaccinated. So if you are refusing, then we do not have work for you, and that may mean a reduction in the work we're able to give you, like a reduction in hours and pay. It's really important, if that is the road you need to go down, that you are doing that as a consultation process. So you're saying what the situation is, giving the employee an opportunity to respond, and then processing the outcome. I'd highly recommend seeking some advice with those kind of ones. In the first instance, though, there's something to be said for just having a conversation with the person and saying, hey, you said you don't want to go into a customer's home who's not vaccinated. We can't really ask people whether or not they are or are not vaccinated because we don't fit any of the, the mandates. Is there anything? What would help you feel comfortable? What can we do to help support you to go into these people's homes and provide the service? And just kind of have that open conversation as your first port of call before, jumping into a consultation process. Do we know if the traffic light system will be done by region? Will there still be borders? So at this stage, yes, that appears that it will be region by region, and there will potentially be regional borders. So certainly, as a situation is currently, Auckland will move into the protection framework as soon as we hit 90% across the 3 DHBs, which means we potentially would move into this framework before the rest of the nation. The rest of the nation at this stage will be moving into this framework when all DHBs across New Zealand have 90%. That might change, especially if we get to March next year and Auckland's in the traffic light system and everyone else is still in alert levels, and it's, they might reevaluate that. But yes, at this stage, there will be regional differences, and there will be borders where there need to be. So with Auckland, that looks like that's going to continue. What is the paid notice period we have to pay if vax is mandatory for all employees and employees choose not to have the vax? Great question. So the important thing to note is that kind of mandate that's been talked about is only under this new protection framework, which is not in place yet. So when it is in place, what you need to do is provide people at least 4 weeks notice, or the notice period in their employment agreement, whichever is greater, and that is paid notice period. And they can, during that time, if they do get vaccinated, then, you'd have to kind of reassess. So currently, how it is, it's a little bit more ambiguous as to whether or not that notice period should be paid or unpaid. If you are covered by one of the other health orders, I would definitely recommend getting in touch and seeking some advice, because it is quite dependent on which health order you're covered by. But in terms of the protection framework, then yes, that is the 4 weeks or their notice period, whichever is greater, if you are dismissing due to not being vaccinated. We are covered under the Health Act mandate to require all staff to have the first vaccine by the 15th of November. What is the correct process to use if we have one staff member who's pregnant, does not want to have the vaccine, and needs to be within 1 metre of patients for extended periods? There are no other jobs that she can do as everyone requires vaccines. Good question, and so tricky, because you feel for this person, and it's a lot of the kind of responses that we're hearing and concerns that we're hearing from employees, they all seem really reasonable. So what we would recommend in that situation is you are required by law to have all staff working with people vaccinated by the 15th, which is next Monday. So what we would recommend now is to start that consultation with that employee, and that will look like a potential outcome is termination of their agreement. So, wanting to help support them. If they have health concerns around their pregnancy and getting the vaccine, you can ask for further information from their medical practitioner, so either their GP or their midwife. So you can ask for some more guidance in terms of what that should look like. Cool. So following on, if you are not a close contact business, are you able to operate in red without a vaccine certificate? It depends. So if you aren't covered by the protection framework in terms of close contact gyms, events, hospitality, then there are those kind of general settings. So if you're retail, you can be open with limited capacity. If you are a workplace that can work from home, that's encouraged, but otherwise it's just those general settings under red. So contact tracing, face coverings, and physical distancing. If our clients are asking that only fully vaccinated staff work with them, does this qualify as a legal requirement? Yes and no. So it certainly opens the door for you to ask about vaccination status, because you've got a genuine business reason for asking for this information, because you need to only send fully vaccinated staff to work with that client. If all of your clients are saying, we only want fully vaccinated staff, you just need to communicate that to your employees. And then if people aren't getting vaccinated, then starting that consultation process and looking for other opportunities. Is there other work that you can have them doing? Is there different areas that you can put them in? So that's kind of you've kind of got to look at all those other potential options. If it's a one-on-one personal training session, so 2 bubbles, do we still need to maintain social distancing between the customer and trainer? If you're talking about under the alert, not alert levels, under the traffic light system, then yes. So under the traffic light system, the kind of concept of bubbles isn't really addressed. And again, this is because the framework hinges on this 90% vax and kind of herd immunity. So if you're a gym doing personal training, you can opt into using vaccine certificates and do that personal training, but they still need to be 1 metre away under red, and then under orange, you're fine to operate as normal if you're using vaccine certificates. We have a close contact business and health, so all our staff are vaxxed. We don't have to insist a vax passport from customers, right? If we don't do the vax passport, do we still get the government support? When the traffic light system was first announced, they said that companies who do not use the vax passports will not receive government support. Yes, that is the understanding. So if we move to the traffic light system and you're choosing not to use vaccination certificates, then there will be reduced government support. What that looks like exactly, we don't know yet, but that is the kind of, the noise they've made around that, is that the government subsidies will not be there. So if you are a close contact business delivering essential services, which under the framework is more tightly defined than it has been under the alert levels. So currently what they've defined that as is supermarkets, GPs, pharmacies, yeah, I think that's it. Then you can't restrict entry and access to your services based on vaccination status for customers. So it's like you're covered by other health orders in terms of employees, but you can't restrict access. People need to be able to go in and get food, right? So that's the kind of look for those essential businesses under this new framework. As a close contact business only of dealing with members of the public, where staff need to work closely together, we're a level 4 business. So yes, at this stage, the guidelines we've gotten around the framework system is that a close contact business, when you are trying to assess whether or not you are a close contact business, it is how well or how closely you interact with the public. And then if you are a close contact business and are using vaccine certificates, then yes, you can mandate vaccinations for your staff. We are mandated for our profession, health sector, to be vaccinated. What happens if they have an exemption now for booster shots? Can they still work in their current role? So the interesting thing with exemptions is, as of yesterday, they announced that all exemptions which have been applied for so far are no longer in place, and people have to reapply, and they're going directly through Dr. Ashley Bloomfield. I don't know him personally, but they're going through his team, because the understanding is that there are a very limited number of exemptions. So if someone does have an exemption and you are covered by any of the health orders, or you have a risk assessment, basically if you have anything that means you can mandate vaccinations, and that person has an exemption, you do need to honour that and work with them to make sure that they can conduct their role in a healthy and safe manner. So this might look like them having some extra PPE. It might look like them having restricted access to certain customers. It really kind of depends on what what the job they're doing is. But yeah, you would need to kind of honour that exemption and let them keep working in their current role. There may be exceptions that you need to make, or changes you need to make to their current role to keep them and others safe. Can we ask vaccination status on an application form? Most of our customers have a requirement for vaccinated only techs and are covered under mandates. If retail and other places all deem their premises to require this, we may need to make redundancies because of this. And why would we employ unvaccinated staff? Great question. So to ask about vaccination status, either with current employees or with candidates for a new employee, you need to have a genuine business reason. So it sounds like you have one. You have a high number of your customers requiring vaccinated people. You could ask for it on an application form. My hesitancy there is, I would recommend you make it really clear why you are asking, who will see this information, what it will be used for, and how you're going to store it. So I'd say, because it's got all those things, I would almost use it as a like a phone screening kind of, couple questions, just kind of getting your vibe. Hey, also we have 90% of our customer base require vaccinated employees. We are asking all candidates whether or not they are vaccinated. If you are not vaccinated or would prefer not to disclose this information, we will treat you as unvaccinated, and that may affect your eligibility for this role, because we have a certain clientele to service, and so there's if you're not vaccinated and we have to have vaccinated people working with these people, then it restricts the kind of work we can have you doing. Can we insist contractors on site are vaccinated? Yes, absolutely. When it comes to contractors, it's a lot easier because you've got, it's more a commercial thing than an employment relations thing. Of course, we would recommend in terms of the Health and Safety at Work Act, contractors are considered workers, so you do have an obligation for their health and safety. So same kind of principles. I would communicate with them, we are planning to mandate that all contractors on site are vaccinated. We are seeking proof of vaccination. If you are not, this is what may happen, and kind of enter into that good faith discussion with them. If one person gets COVID in the office, will everyone in the office require to stay home for 14 days in all light levels? Great question, and I'm really sorry, but we actually don't know the answer yet. As it currently stands, if someone contracted COVID, you would contact the Ministry of Health or Healthline, and they would tell you who is determined to be a close contact. So if you're in an office situation, you have 50 people in the office, maybe only 10 of those would be considered close contact because it's the people who work directly next to that person, directly opposite, it's that close kind of within 2 meters for the majority of the day. That's something that Healthline will be able to guide you on. And then in terms of how long they're required to stay home for also depends on how they are identified by the Ministry of Health. So if they're close contacts, the current regulations are that they stay at home for 14 days and get 2 tests. If they are a casual contact, it's 5 days. So in the light levels, if that still is a requirement, remains to be seen. My personal thoughts on it, given like I said, the principle of this framework is that the majority of people are vaccinated, and so the risk is considerably low. I don't think it will be as long, but that's a Jocelyn kind of feeling, not a actually in law thing. Can sales teams see clients or attend meetings? So if you're talking about under the protection framework, then under red, it is recommended that they don't, and that is still conducted virtually. Under orange, they can with, and you might want to put extra control measures in place like masks. You don't necessarily have to, but it might be something you want to consider. And then under green, it's fine. Could you please comment more on the good faith processes to follow? For example, as an open plan office business, should we survey our employees for their views, conduct a risk assessment, and then set vaccination policy if that fits with this assessment, or is it okay to just do a risk assessment and then policy? Either are totally fine. So, it also, so much of this kind of depends on your vibe of your business as well. Like at MyHR, for example, it's a very open, transparent culture. So we would be likely to tell staff this is what we're planning on doing, then enact it. You can just go and conduct a risk assessment. That is a perfectly valid health and safety tool to assess the risks and control measures in your workplace. And then off the back of that, you could put in place a policy. The consultation good faith bit comes there. So whether you chat to your staff now and go, hey, we're kind of thinking about doing a risk assessment, what does everyone kind of feel? Are you all kind of pro-vax and you don't really think this is necessary? What's your vibe? That's fine. If you want to jump straight into a risk assessment, that's fine. The next step of either of those is a policy and then holding employees to that policy, so mandating behaviour, and that's where the good faith consultation process is so important. So what that looks like is you would let the team know what the policy is, or the proposed policy, how it affects them, what the consequences are. So as an example, we've conducted a risk assessment and all our roles are assessed to be of a risk level where mandating vaccines is a requirement. You'll need to share that risk assessment with them. Finishing that thought, all roles are are required to be vaccinated. And so if you don't get vaccinated, we will look at redeployment or potentially termination options. So that's the kind of consultation process to introduce these policies and mandate vaccines. Under the protection framework, if you are choosing to opt into vaccine certificates, like I said before, you can let your team know that that's what you're planning to do, but don't go enacting anything yet because it's not in place yet. Right, we've got our businesses door to door. Are we able to operate under red? Without vaccine certificates, we practice social distancing, etc., but need to sign documents with customers. Just on the face of it, Karen, from reading what you've said, if you're able to kind of, for the majority of the time, keep that 1 meter distance. One of the guidelines is this 15 minutes, 15 minutes of face-to-face contact. If it's over that, you probably are a close contact business. So if literally the only time you need to be within 1 meter of the public is to sign a document, you'd probably be safe to say that you're not a close contact business and don't need to worry about vaccine certificates and just operate under red with those other social distancing and masks and other control measures in place. Understood the MBIE or PHO, we're reviewing the close contact businesses list to include other business types, especially those that are providing a regulatory service. Is this correct? Happy to discuss offline. Yeah, feel free to email through to help@myhr.works if you wanted to chat about your specific business. This is an anonymous question. But in general, what we've understood in terms of the information that's out there is the close contact. What defines a close contact business is probably likely to be refined further. But at the moment, those kind of general guidelines that I mentioned before, I'd be pretty safe to rely on those to kind of make that assessment. We work in hospitality, and some locations are the hole-in-the-wall style operations that can work with an essentially contactless outdoor service, whilst others are indoor and closer contact. Do you think it's better to make decisions as a collective business or work site by site? Either or. The important thing is the process. If you are going to treat the whole business as, treat everyone the same, I would just really clearly outline to your staff that that's what you're planning to do and why you're making that assessment. In general, I think it's better to kind of go site by site, but if that's not manageable or you kind of want to go, at this point, we're looking at the business as a whole, and then based on that feedback, we might look at site by site, and that's doable too. Just let people know what it is you're planning, what it means, and how they can give you feedback before you actually enact anything. Can you consult with your employees around their level of comfort as to whether to opt into vaccine certificates to make the decision? We run outdoor events with large groups of people, so it's mainly about staff wellbeing. And what we want to do as the risk is probably quite low in an outdoor setting and with other control measures. Yeah, totally. That's a really great idea, Maureen. I definitely think having a kind of informal, like pulse or survey with your team to say, hey, what do you guys think? We have the choice as a business to opt in or opt out to vaccine certificates. What do you think we should do? I would just be really clear to people how you're going to use this information. So if you're just kind of getting the pulse of the business, letting them know this is just kind of an understanding of where everyone's sitting. This isn't a final decision. We reserve the right to make a final decision. And of course, for other businesses that are listening, the other thing you want to consider is, of course, your commercial interests. Can you, if you are not able to open under red without vaccine certificates, can you bear that cost? Is that doable for you and your business? I hear that once the rest of the country moves to the traffic light framework, that it will be straight to orange. That certainly does seem to be what the current kind of understanding is. Obviously not Auckland, but the rest of the country, because orange kind of relates to alert level 2 if we're kind of looking like for like. But again, that's still to be determined. So I think you're safe to start planning for that and telling your team this is your assumption and you're planning to move into orange and this is what that will mean. But I wouldn't make any final decisions until we have a definitive answer. When will travel for businesses for training be allowed? If the trainer is based in Auckland and needs to travel out of Auckland to train groups of 8 to 10 people, will this be allowed, and same for within Auckland? So with the travel, if different regions are in different levels of the protection framework, so different lights, like Auckland's in red and the rest of New Zealand's in orange, there will still be a border and you will be able to apply for travel exemptions. So same as currently, if you need to travel in or out of Auckland for work, you can apply for an exemption. I think they're calling it a passport. So you can still do that. Has there been any indication that construction sites will be mandated to be fully vaccinated? There has not, and this is probably a big industry that, it's kind of unclear what you will or will not be able to do in the construction area under this framework. What I would recommend to anyone who is in the construction industry is have a look at the general settings of red and whether or not you're able to open. Most kind of, construction work, especially if it's on a site rather than in people's homes, like a plumber or electrician, you are able to reasonably accommodate those other control measures, such as physical distancing and masks. So there may not be a need to. And of course, if it is something that you are looking at doing, you could look at doing a risk assessment to understand whether or not your team should be fully vaccinated. If an employee has chosen not to vaccinate and has been given their 4 weeks notice period, then chooses to be vaccinated during this time, are we then required to offer them their rollback? Good faith provisions apply here. So if someone did change their mind, we would recommend that yes, you engage with them in good faith to look at reinstating them back into that role. If you've already commenced recruitment or even offered someone that role, then again, I would still recommend consulting with them in good faith to understand if there's any other roles you can give them, or if you are going to uphold their termination. So it kind of depends what's going on in the business, but I would just chat to them and have that kind of good faith discussion. For offices in orange, can we open and contact trace and mask encouraged? Is that right? How about distancing between tables and people? So yes, that is correct. You can open, there are no physical distancing requirements, mask use is encouraged and contact tracing is a must. So yes, correct. Another construction industry, is it enough that staff are in close proximity to each other and clients to enforce the vaccination requirement? And also clients are asking if workers are vaccinated, would this stack up as a risk assessment or should there be more criteria? So that would not count as a risk assessment. A risk assessment looks at all the different factors of a job and rates them in terms of risk and control measures. So your kind of likelihood of getting infected with COVID-19 versus the potential impact of that. Is that likely to get people in hospital? So with the construction industry, if you've got clients who are requiring only vaccinated people, you can ask the question. So you can ask your team, hey, we've got client XYZ who only wants to work with vaccinated people. Can you let me know your vaccination status so that we can only send vaccinated people to those sites? As I said before, if that's like 99% of your client base, then you would just need to tell people that that's what the situation is and kind of deal with it on a case by case, because you're not mandating vaccines based on role. You're mandating vaccines based on the fact that there is only work available for vaccinated people. So it kind of goes into this weird gray area. So it would really depend on kind of the individual situations that are happening there. businesses required to keep a record of their employees' vaccination status. If you are opting into the use of vaccine certificates, then yes, you will be required to keep a record of their vaccination status and potentially proof as well. So those vaccine certificates on file somewhere. Privacy Act provisions apply. Keep it safe, keep it secret. It's 3 o'clock now. I'm quite happy to stay on for, I can probably do another 5-10 minutes to just answer the last few questions. But if anyone does need to head off, feel free to. If we do get cut off and I'm not able to get to the rest of the questions, I'll make a note of them and we'll make sure that we send out like an FAQ blog or something, because a few of them are anonymous, so I won't be able to touch base with you personally. But yes, if you have to head off, feel free, and I'll just stay on the line and keep answering questions in the meantime. All right, if we can open it under the traffic light system, but our customers are not happy with the social distancing and they want to cancel, keep their memberships on hold, do you think we will still qualify for subsidies if we have a reduction of income more than 30 or 40%? It really depends. There hasn't been a clear, this is what the government support packages will look like under the traffic light system. So if you are able to open and opting into vaccine certificates and still facing a reduction of income, it seems likely that there will be subsidies in place, but that hasn't been confirmed yet, sorry. Awesome. We have groups of volunteers or charitable organisations doing work on our behalf or with us directly in collaboration. Can we mandate them to be vaccinated if we opt into vaccine certificates? How do you enforce it if they're in a different region? So when it comes to mandating other organisations that you work with in terms of vaccine certificates, same kind of principles. I would let your stakeholders know what it is you're planning to do and how it will affect them and what you need from them. So in most situations, a letter confirming that all their staff are vaccinated is sufficient. Again, under the Privacy Act, organisations should only be sharing that information where it's relevant. So, a spreadsheet of employee name, NHI number, vaccine status, it's not necessary and it would be excessive. You'd be better off to just have a formal letter that says, 90% of our employees are vaccinated. Do you require vaccinated people on your site? And then in the reverse, if you are mandating them to be vaccinated, same thing. You can tell them, we are choosing to opt into vaccine certificates. This means that we are asking all stakeholders that we work with to be vaccinated. This is the information we need from you. This is how we're going to store it. In terms of enforcing it, especially with events, that's where it looks like this kind of QR code, vaccine certificate, or vaccine passport thing will come into play. But unsure how exactly that's going to look at this stage, but it certainly looks like the discussions that have been around like R&V and kind of festivals over summer is there will be like a simple kind of scan in type thing similar to the tracker, COVID tracker app. We provide tertiary education, which consists of classroom and practical workshops. Social distancing of the students will be impossible. And during the practical, under the red light, what must students do regarding protection? Can we ask them for vaccination status? So yeah, if you are a tertiary provider, you can opt in to the vaccine certificates, in which case you can require vaccines for on-site delivery. You will have capacity limits and there will be social distancing in place. If you choose not to use vaccine certificates, then no, you will not be able to open. You will only be able to do distance learning. My staff in Auckland are refusing to get vaccinated. We are a close contact business. I have staff who are based in Wellington who are happy to go up to Auckland to fill the roles, but they want to be able to come back to Wellington. As a business owner, I also need to be able to go back and forth between the two cities, especially now we've lost half our staff. Is this possible after we move to the traffic light? Yeah, it looks like it will be. It looks like travel under the traffic light system when all of the nation is under it will be a lot more fluid. What remains to kind of be seen is if Auckland moves to the traffic light system this side of Christmas, and the rest of New Zealand does not move yet, how will that impact travel in and out of Auckland? It looks like similar restrictions are going to be in place in terms of border exemptions, but it does also look like it's going to be a little bit freer, and yeah, have a bit more space to move. Do you do a risk assessment based on each individual role and the requirements of the role, or is it a holistic view of the business and all roles? So it's role-based. You can group roles. So if you're, like a massive multinational and you've got, tradies and you've got hospo staff and you've got office workers, you can group those. So like office workers, you can go, okay, fundamentally the finance team, the HR team, the marketing team, the type of work they are doing is the same. So we're going to group them as a general office worker group. Can retailers refuse mask exemptions in store? Hard one. It currently looks like they can't under the framework. What I think is kind of important to navigate when it comes to mask exemptions is obviously, there's been a lot of media around like fake exemptions, and that just sucks that it's happening. But you kind of have to take it at face value. So if someone is showing a mask exemption, just say, take it on face value that it is genuine. And they don't have to wear a mask. What you could do is make it really clear to people who are not able to wear masks in store that they do have to remain physically distant, and up to 2 meters. And you could kind of I wouldn't restrict entry, but you could certainly empower your team to approach people and say, excuse me, you're not keeping your physical distance. We are required to do this. Can you please keep that in mind? We are a retail business that under the framework wouldn't require vaccine certificates. We do hold customer events like breakfast and sales. What is the definition of an event under the new framework? Great question. An event is an event. Really nice and clear. So it looks like it's any event that is indoor, outdoor, where a group of people would be gathering. So under red, if you're using vaccine certificates, this is up to 100 people and socially distanced, seated and separated. If you are not using vaccine certificates, then you are not able to hold events. So I'd say what you could do as a retail business is go, okay, well, for our retail business, we won't be using vaccine certificates, but for these specific events, we will be using vaccine certificates, and this is what that means. And people running those events or helping, take part in those events will need to be vaccinated from an employee point of view. The majority of our staff have shared with us that they are double vaxxed, and we have a few who aren't. Those who are vaxxed here have shared their concerns about working with those who aren't vaxxed, but I don't think we qualify as being a close contact business. What are our options? Can we ask those who aren't vaxxed to wear masks and socially distance, work from home at red and orange, for example? Yes and no. So the tricky area is that you can't discriminate or you can't restrict the work that people do based on vaccination status. So if you are like in an office space, I would just say that under red, get people to work from home, and under orange, give people the option if that's doable for your business. If it's not, I'd need to kind of chat through the specific situation a bit more, but in general terms, I would say, you shouldn't be restricting the work that people do based on vaccination status, but you can say, in general, these are our guidelines. We as a business under orange are choosing to have people socially distance where they can, wear masks in and out of the office, etc. We are a Bay of Plenty manufacturing company that have all staff visit multitudes of sites for different reasons. Some sites are home renovations and others construction sites for new builds. We also have clients come into our showroom to meet with designers. Once borders open, are we able to ask clients their vaccination status before we go on site or allow them into the showroom? Currently, no, like the short answer is no. If you, how would you be able to do it? You wouldn't be covered under the kind of definitions of a close contact business, potentially, depending how close you're working with people, but on the base of it, I don't think you would be covered, and so therefore wouldn't be able to use vaccine certificates. You could ask people, you could encourage it and ask people, you know, your staff to kind of share their status if you've got a genuine reason. But in general, it's kind of that hard zone where you're not really able to actually ask about vaccination status. All right, I'm going to answer this one last question and then I'm going to have to wrap up. I have a staff member who has openly informed me that her mask exemption came from someone else. As a manager, what avenues of discussion can I enter into with her? We are retail, she's not vaccinated. Mask mandate as opposed to a law. Don't feel we have any grounds to have a discussion. She's a great employee. I was struggling with her decisions around this behaviour. So you could push back and you could say, you know, you've informed me that your mask exemption came from someone else. I am requiring you to get a mask exemption from a medical practitioner. You might even want to cover the cost of that and say, you know, if you go see your GP, you can get reimbursed for that, the cost of that visit. If you are aware that this is potentially fraudulent, you could potentially look at a disciplinary process for, not acting in good faith and actively deceiving you. It sounds like that's kind of not what you want to do in terms of this is a good employee, but you know that is an option in terms of saying you have informed me that this is false. So either you need to wear a mask or you need to get an exemption from a medical practitioner, or I will be looking at disciplinary action. Okay. All right, I'm going to have to dash off, team. But I've had my our email address and website on the screen here. So if you do have any lingering questions, feel free to chuck them through to help@myhr.works. Feel free to give us a call. This recording will be available post this session. So if you have missed any of it, then you will be able to catch up. So yeah, thank you everyone for your time and attention. It's been great, lots of amazing questions, so really appreciate that. It's what makes it really, really interesting. So thank you everyone for attending, and I hope you all have a great rest of your day.